Hello, this is Kathy Bukowski. I'm the owner of the CV Health Insurance YouTube channel, and today's video is going to cover how much does Medicare Part D drug coverage cost. Before we continue, I want to remind everybody to make sure to subscribe and click the little bell so that you will be notified of when our future videos are posting. So let's get right into today's topic. What is the cost to have Part D coverage? Well, there's really two components to this. One is the premium that you're going to pay, the monthly premium for the drug coverage that you choose. And two is going to be any out-of-pocket costs that you would incur when you go fill a prescription. So for example, if you paid a copay or coinsurance, or if you had a deductible. So those are all costs associated with having drug coverage. Let's start with the premiums first, because everybody asks me, how much does it cost for Part D? Premiums can vary. They can run anywhere from $15 a month up to $130 a month. And I've seen them higher. Some people will say, well, what's the difference? Good question. There's a big difference in benefits. Just like with traditional health insurance, the more expensive the plan is, usually the richer the benefits. The lower your deductibles, the lower your out-of-pocket costs. That is also true, but not always. So it pays to shop. Generally speaking, there can be a deductible. For example, one of the benefits is an annual deductible, and this is set by the government. CMS actually every year will decide what that maximum deductible can be. And the drug cards that are offered can offer anywhere from zero deductible all the way up to that maximum. For 2020, that's $435. So you could have the most expensive card actually waive the deductible on all tiers, whether you're filling a generic, a brand name, a specialty drug, whether you do it at the pharmacy, you do a mail order, there's no deductible. And on the low end, you can have a deductible applied to all tiers. So that is a big difference in the benefits. And that's the reason for the difference in the premiums. In addition to the annual premium, and it's really charged monthly, the monthly premium, you could be looking at an additional cost if your income is above a certain level. So what are those levels? There's actually an IRMA chart. IRMA stands for Income Related Monthly Adjustment Amount. And it's set by the government. And let me show you what that looks like. So if we go over to Medicare.gov, there's actually bring it up real quick. Here we go. Medicare.gov. If we go to the drug coverage tab here, Part D drug coverage and costs of Medicare, you'll see that they list premiums and then they mention deductibles, copays, the other costs associated with Part D drug coverage. If we click on this premium and we scroll down, you will see they discuss IRMA. So IRMA is, as it states right here, the income-related monthly adjustment amount. If you continue to scroll down, here's the chart. They have it by columns. If you are single, filing your own tax return. If you're married, filing jointly. If you're married, filing separately. The first line item here is if your income is this amount or less. So for a single individual, it's $87,000. Married, filing jointly, have $174,000 or less. And then if you file separately, you see it's the same number as a single. You are not going to have an IRMA. You're not going to have any extra premium. You will only pay the premium for that Part D coverage that you choose. And as I had mentioned earlier, it could be $15 up to $130 a month. However, if your income is higher, and if you're single and you make over $87,000, and you'll notice this is the 2020 chart. They do a 2-year look back. So when you are enrolling, they're looking at your tax returns. Some people don't file right in January, and some people delay and don't file to the end of the year. So they do a 2-year look back on your income. If your income falls in this category, if you're married filing jointly, you are going to pay, if you're between $218,000 and $272,000 of annual income 2 years ago, you're going to pay that Part D premium plus an additional $31.50 a month. Now that extra premium is going to be billed by the Social Security office. You will actually get a bill in the mail, and there's a couple of options to pay. But this is a great reference tool. We actually have this chart in a PDF file. If you are interested in it, you can contact our office, or you can just go to the Medicare website and take a look at that. So getting back to what are the costs of Medicare Part D drug coverage? Well, one was the premium, and it could be anywhere from $15 to $70 a month. Two was the IRMA. And some people will say, well, I don't take any medication. Why can't I just skip signing up? Well, there's a problem with that. If you skip signing up, you will be penalized a late penalty. So you absolutely want to pay. They do talk about the late penalty on the website. It tacks on an extra premium when you sign up later for the rest of your life. So don't do that. Don't delay. But we don't want to talk about penalties. We want to talk about the actual cost. So if we're enrolling, we have the premium. And the second component is going to be the deductibles and copays. So let's talk about that a little bit. There is an potential annual deductible depending on the drug card, and the maximum for the year of 2020 is $435. As I mentioned, some drug cards do not have a deductible, or they might waive the deductible for a tier 1 or tier 2 drug, typically generic drugs. So you will want to check the formulary list and make sure, one, that your drugs are covered under that drug card, and two, at what level are they covered? Do I have to satisfy this annual deductible? Is the deductible waived? Because that's going to go into your overall calculation of how much you're spending out of pocket. What is this drug card costing you? Okay. So when we look at the costs of Medicare drug coverage, and we're looking at specifically the benefits, there are deductibles, there's also coinsurance and copayments. So the way this works is like this. All drug cards have a 3-tiered program. The first level that you're going to have to satisfy is the deductible and copayments. The second tier is going to be the gap coverage. They used to call this the donut hole, and I guess that wasn't a very nice term. A lot of people did not like that. It's now called the coverage gap. And the last is going to be the catastrophic. All cards have these 3 tiers. The first tier is the deductible, and some plans can have a deductible, and copayments. What are copayments? So let's say I have XYZ drug card, and I am going to fill my generic medication. I don't have a deductible, but I go to the pharmacy and I fill it. I might have a $5 copayment. I might have a $10 copayment. You could also have, for the higher, more expensive drugs, coinsurance. And what is coinsurance? Coinsurance is you're going to have to pay a percentage, not a flat dollar amount. So the drug card is going to pay 75%, and you're going to pay 25% of the cost of that drug. Typically, you will see that on more expensive drugs. The lower cost, the generics, you're going to have a copayment. And some drug cards, believe it or not, tier 1, lowest cost, will have a 0 copayment. So you definitely want to take a look and see how your meds are covered under the various drug cards. The coverage gap. So you move from tier 1 to tier 2 to tier 3 based on some criteria. Moving from the deductible and the coinsurance to the coverage gap is based on an annual retail drug cost. And every year this changes. For 2020, it's $4,020. And once you hit that, you go into the gap coverage. What is the gap coverage? Well, the gap coverage is where you don't have a deductible, you don't have copayments. However, the manufacturers of the drugs are required to discount the drugs. And between the discount and the cost of the drug picking it up, they are covering 75% of the cost of the drug and you only pay 25%. Now, some people, based on their annual retail drug cost, $4,000, they're never going to get to the coverage gap. You know, if you take 4,000 divided by 12, if you have less than that monthly basis retail cost, you're never going to get to that level. This is on a calendar year basis. Those people that do, some people hit it in December, some people hit it in May. Okay, so you're going to pay 25% of the retail cost of the drug until you hit an annual out-of-pocket maximum of $6,350 for 2020. That's when you're going to move to the third level, and that third level is called the catastrophic coverage. The catastrophic coverage is going to pretty much subsidize the vast majority of the drugs, 95%. You are going to pay 5% of the cost or a very small copayment, whichever is higher. So I tell people generally 5% of the cost. And every year, your deductible is going to reset. Your benefits are going to reset. So Medicare operates on a calendar year basis. That's from January till December. And then starting the following January, you start over. So if you start the drug card in the middle, you're retiring or turning 65 in the month of July, you've got till the end of the year and you're going to start over. So the costs associated with Medicare Part D drug coverage, the standalone drug coverage, are both the premiums that you can pay for the drug coverage. If your income is above a certain level, you could pay an IRMA premium. If you delay enrolling, you could pay a late penalty. Don't do that. And last but not least, you're going to pay deductibles and copays. So all of these things need to be calculated. And there is a tool on the government's website. You can go to Medicare.gov, and I believe it's under the sign up page that you can actually put in the medications that you're taking, and it will, based on if it's a generic and what the dosage is, how often you fill it, what pharmacies you go to. You can say, I like mail order, I don't like mail order, I prefer Osco or CVS or Mariano's or Walgreens, and it will tell you on an annual basis the lowest cost. I will tell you this tool is a little tricky to use, but our office actually offers to do this for you. So if you would like some help in calculating what your annual cost would be for Part D drug coverage, please be sure to contact our office at info@cbhealthinsurance.com. info@cbhealthinsurance.com. If you found this video helpful, I hope you will share it with your friends. Be sure to subscribe to our channel and stay tuned for the next video. Thanks for watching.